go to the cloud. Okay. So, so I'd like to welcome everybody today to our webinar. We're really excited to have such an eminent speaker, Dr. Trevor Hancock, with us today. My name is Fiona Hanley, and I'm the Quebec representative for CAIN. And so I will just do a very short introduction of Dr. Hancock, and then he can take it away. Just to let you know as well, too, like I said, we're recording this session, and so we will make it widely available through some kind of medium. I'm not exactly sure how that's going to work out, but there'll be news about that in the coming few weeks. So you can keep an eye out for that. So if you have any comments or questions, please use the chat box. Or you can also raise your hand. Those of you who know how to use that blue hand, you can raise your hand and we'll try to get through the questions at the end of the talk. So Dr. Trevor Hancock is a public health physician and health promotion consultant who retired from his position as professor and senior scholar at the School of Public Health and Social Policy, University of Victoria in 2018. In the 1980s, Dr. Hancock helped to create the global Healthy Cities movement and has been an internationally recognized leader in this area for more than 30 years, often drawing attention to the links between healthy and sustainable communities. He has been a leader on issues of health and the environment for decades and co-founded the Canadian Association of Physicians for the Environment back in 1993. In 2012, Dr. Hancock was asked to lead a Canadian Public Health Association task force that produced a comprehensive report in 2015 on the ecological determinants of health, which probably many of you are familiar with. In recent years, he has focused on health in the Anthropocene and the concept of a one planet community region as a way to integrate the concepts of healthy and sustainable communities. And in retirement, has started a new NGO, Conversions for One Planet region, to explore and popularize these ideas in the Greater Victoria region where he lives. We're really delighted to have Dr. Hancock with us today and to hear his presentation on health in the Anthropocene. So he will talk about the Anthropocene and its societal and health implications, including the important fact that here in Canada, we must rapidly reduce our ecological footprint by about 80% to take only our fair share of the Earth's biocapacity and resources. Dr. Hancock will then explore the role of health professionals in responding to these challenges, both as professionals within the healthcare system and as citizens. And in particular, he will explore the societal problems that COVID has revealed and the opportunity that the post-COVID recovery presents for us to build back better, and the concept of a one planet community and its health co-benefits. So Trevor, I'll hand it to you now, and hopefully you can share your screen.
Thank you. Well, good afternoon, everybody. It's a pleasure to be here, and it's particularly a pleasure to be able to link with CAIN and CAPE. That's a partnership that we need to foster and strengthen. As Fiona said, I'm going to cover a lot of territory in a real hurry, and so I will do that. I should just say that I am on the ancestral lands of the Lekwungen speaking peoples, and particularly the Songhees and Esquimalt peoples, whose unceded territory we live upon, and we're very grateful for that privilege. So with that, I will share my screen and run through quite a lot of material quite quickly. And I'll just go to full screen here. There we go. So you've heard what I'm going to talk about, and this is pretty much the outline and what I call in section 3, the COVID reveal, what we've learned, I think, from the COVID pandemic. So if you haven't seen this little movie yet, I suggest you do so at some time. If you just Google "Welcome to the Anthropocene," it will pop up. It was actually made in 2012, and it's 3.5 to 4 minutes long and well worth watching and showing. Great thing to show to students, for example, because it covers everything that there is to say about the Anthropocene in 3 or 4 minutes. I'm going to take a bit longer than that. So I don't know how many of you are familiar with the Anthropocene, but I think it's important to understand that it's 3 different things, really. It's a geological phenomenon first and foremost. That's where it started from. It's a new geological epoch. But that geological phenomenon reflects a set of massive and rapid global ecological changes, which is its second aspect. And the third aspect is that it's really us. We are the anthropos in the Anthropocene, that being the ancient Greek word for human. And so it's all 3 of these. In geological terms, we are laying down materials that millions of years into the future will give evidence of the presence of humanity. So it's minerals that don't exist in nature, such as pure aluminum or tungsten carbide. It's glass and plastic and concrete. It's a bunch of chemicals. It's radioactive particles. And I think even more significantly, and perhaps somewhat underappreciated, is at the bottom the changes in fossil assemblages, which is to say that paleontologists in the future will see this as a point when 1/3 of the mass of all land vertebrates is actually humans, and almost all of the rest is domesticated species. And so wild species now make up less than 5% of the fossils that are being laid down in the geological record. So that in itself will tell future paleontologists that we were here. And in fact, there is something called the International Commission on Stratigraphy, which is charged with sort of keeping an eye on and naming new geological epochs. Since they only happen every few thousand years, it can't be a very busy commission. But they did set up an Anthropocene working group, and that group, as it says here, about 1.5 years ago now, voted 88% in favor of treating the Anthropocene as a formal geologic epoch. They call it a chronostratigraphic unit, with a mid-20th century start base. In other words, it started around the middle of the 20th century, about 70 years ago now, which is in geologic terms of the blink of an eye. Now, the second thing that's really important to understand about the Anthropocene is it's reflecting not just climate change, and these are some common charts you'll have seen on climate change, surface temperature and annual CO2 emissions, Arctic summer sea ice, global average sea level, the sort of things we talk about all the time these days. But the Anthropocene is much more than just climate change. It includes ocean acidification, ozone layer depletion, resource depletion, both renewable resources such as forests and fisheries and soils, and non-renewable resources such as minerals. Pollution, and in particular ecotoxicity, which is to say, as I'm sure many of you know, that we all carry a body burden of persistent organic pollutants, and our entire food chains and food webs are contaminated with these things. And then probably as a sort of end point of all of these changes, we're seeing the species extinctions that are reflected in the changes in the paleontological remains. And of course, the problem is that all of these are happening at the same time. So we're not just dealing with climate change, we're dealing with all of these at the same time. And so this constitutes really an existential challenge to our society, perhaps not to our species. We're a very tough and resilient species. We can be thought of as a weed species like dandelions and cockroaches and rats, and we'll probably just manage to survive. But our societies, are certainly the way we know them, likely will not. So it is both the scale of this and the rapidity of this that really matters here. And I think many of you may be familiar with this notion of planetary boundaries, and we are crossing some planetary boundaries such as biosphere integrity and in particular species extinctions, top left, and then the red area in the bottom, phosphorus and nitrogen flows, and a number of other areas where we're in the yellow zone of increasing risk, land system change, climate change, beginning to get there with ocean acidification. And then some areas where we have no idea what the planetary boundary might be. But we are crossing or approaching planetary boundaries we should not cross. And those are driven by 3 very powerful forces. Firstly, global GDP grew 11-fold since 1950. At the same time, population grew threefold since 1950. And so this combination of economic growth, which means growth in consumption of materials and production of pollutants, and population growth is all enabled by the power of our technology. And it's happening very rapidly. And this is the point about the start date being set in 1950. The red line or red arrows here denote a line on each chart that indicates 1950. And you will see on the left a set of socioeconomic trends. So top in the middle is real GDP, for example, and you can see how much it's shot up since 1950. And Earth system trends on the right, and you can see in particular things like stratospheric ozone, marine fish capture towards the bottom on the left, nitrogen to coastal zone across from that on the right, and so on. The message is really quite simple. For a lot of these things, not interestingly for domesticated land, bottom center on the blue side, and that's because there's really no land left for us to domesticate. We've already pretty much domesticated all we can, except for the Amazon, which is now being taken down in a big way. So this is happening in geological and ecological terms extremely rapidly. In fact, even in our terms, this has all happened within my lifetime. I was born in 1948. This is all within my lifetime. And it's having some devastating impacts. So this is the most recent Living Planet report from the Worldwide Fund for Nature, came out this year. With data only note to 2016, there has been a 68% decline in the average abundance of populations of vertebrates in a number of different populations monitored all over the planet. 68% decline since 1970. We don't seem to be doing so badly in Canada. In fact, we've actually seen a slight increase in our population counts, but that's probably because we're a wealthy nation that is now learning to protect our species, not terribly well, but well enough, while we exploit the lands and resources of other countries. But when you look at our species at risk, then you get a very different picture. So this is the decline in the counts of species, vertebrate species considered at risk of extinction in Canada. And you'll see that since 1970, there's been a 59% decline, and the introduction of the Species at Risk Act in 2002 doesn't really seem to have halted the decline. So we've still got a long way to go. We also, as I'm sure you know, are exceeding the Earth's biocapacity. This is the ecological footprint. And while world biocapacity has increased about 27%, and that's largely because we have fertilized and to some extent warmed the planet, and so it's more productive with the green space that's there. But our footprint has increased 190% in that same period. And so we, somewhere around 1970, it's estimated, we surpassed if you like, the Earth's carrying capacity, and we continue to go up. Now in Canada, we haven't just surpassed it by 1.7 planets worth, that's the global picture. We actually act as if we had almost 5 planets. Our ecological footprint is 4.7 planets according to the Global Footprint Network. But of course, what we actually have is this. And so what this means is that if we're going to only take our fair share, if we're not going to continue to exploit other countries' resources excessively, if we're going to take simply our fair share and emit our fair share of pollutants, so carbon dioxide most notably, then we're going to have to reduce our ecological footprint by almost 80%. And remember, about 60% of our footprint is carbon. So this means a very massive and rapid reduction in our quantitative footprint on the planet. But at the same time, and this is where the human aspect of the Anthropocene comes in, we still need to meet basic needs and ensure high levels of human and social development and good health for everyone, and particularly as nurses and as physicians, as health professionals in general. That's our main concern, is how do we how do we make these dramatic changes that we have to make for the health of society and the planet, while at the same time protecting the health of society and of the people that we serve? So that really is the fundamental challenge, the grand challenge, if you like. How do we live equitably, in harmony and in good health on this one small planet that we call home? Now, I know I'm preaching to the converted here, but I wanted to lay down a base from which we can operate. So let me then talk very briefly, and again, I'm just going to touch on some key points here about planetary health and the ecological determinants of health. This is the report that Fiona mentioned in the introduction, that perhaps many of you are familiar with, that we produced 5 years ago now. And that on the left is the 30-page discussion document, on the right is a 100-page report. We called it the report in brief because it was distilled from a 500-page document that we never did publish, and it was just too big and too much to put out. So it's really as simple as this. The fundamental things on which we depend are oxygen and water and food, the materials. So if you look around you, everything that you see around you, the books on my shelf, the coffee in my mug, the energy that powers this webcast, it all comes from nature. All our fuels come from nature, and so on. And so these are the most fundamental determinants of health. And we've very much tended to focus for the last 30 years on the social determinants of health and neglected these. So we have to bring them back in, not throw out the social, but bring together and integrate the ecological and social determinants of health. And that was a key point of our message. At the same time that we did that, the Rockefeller Foundation, together with the Lancet, had a commission on planetary health, which you'll notice its subtitle was Safeguarding Human Health in the Anthropocene Epoch. And planetary health, as they defined it, was about the health of human civilization and the state of the natural systems on which it depends. Hence my comment about what we're seeing being an existential threat to human civilization. And they wrote in their report, we have been mortgaging the health of future generations to realize economic and development gains in the present. Now, unfortunately, this was not a new sentiment. So this goes back 10 years before that, 2005. The UN Secretary General set up a Millennium Ecosystem Assessment in 2000, which reported in 2005 to the UN. And they said this, that the ability of the planet's ecosystems to sustain future generations can no longer be taken for granted. So an important part of our focus has to be on these future generations whose health we are currently mortgaging, and hence all of the activism among young people. Even more recently, in 2019, 18 months ago now, roughly, the Intergovernmental Science Policy Platform on Biodiversity and Ecosystem. So this is the biodiversity equivalent to the Intergovernmental Panel on Climate Change. They came out with a report and said much the same. We are eroding the very foundations of our economies, livelihoods, food security, health, note, and the quality of life worldwide. So we're not lacking in evidence, we are lacking in action. Which takes me to what I've called here the COVID reveal, which is what have we learned from COVID? And I put all this in the context of one of my favorite phrases, which is almost 2,000 years old now, but still worth repeating. The good of the people shall be the supreme law. So when we talk about a well-being based recovery or a well-being economy or a well-being society, that's what we're talking about. And it's not new. Cicero knew 2,000 years ago. The good of the people shall be the supreme law. What if we actually believed that and did that? And that, I think, is one of the central messages that we need to be taking forward as Kane and as CAPE, is that we have to be focused not on economic growth, and I'll come back to that. So here's some of the things that I think we've learned from COVID. We've seen the price we pay for our way of life. And if you go back to the early days of COVID, suddenly it was quieter. We saw that emissions were down quite dramatically. Air quality was improved. Motor vehicle crashes and deaths were down. The mountains were visible. People were posting photographs from India saying, I can see the mountains. I can see the Himalayas from 100 kilometers away, which I've never seen before. And we were spending more time in nature and at home in our communities and so on. So I think it began to make clear the price we pay for our way of life. The second thing that I think we have learned from COVID is that we have systematically undervalued and underpaid essential workers. When push comes to shove, it is not the technology billionaires that matter. The people that matter are the people who stock our food, grow our food, stock our food shelves, move goods and services around, maintain our energy systems and our water systems and all the rest of it. And we undervalue them and we underpay them, and that has to stop. The third lesson I think we've learned is the importance of community, of togetherness, which does rather look as though it's beginning to break down a little bit right now. We need to relearn that lesson perhaps, and the important role of government in all of this. So you can no longer just dismiss government and walk around saying taxes don't matter, we shouldn't pay them. None of this is possible without government and without taxes. And if you look to the south, to the US, you can see exactly what happens when you don't value government and you don't value community. That's not the way we want to go. And I think the fourth thing we can learn from COVID is that we can change, if we can change everything for this one global crisis, for COVID, we could change it for others, for climate change, for the Anthropocene, for all of the other things. So we can summon and marshal the resources and the willpower to make big changes in a hurry. For COVID, why can't we do that for climate change? And of course, we're not alone in saying that, but I think as health professionals, that's a particularly important thing for us to say. And it's being said at all levels. So here's the World Health Organization in May of this year, put forward what it called its manifesto for a healthy and green COVID-19 recovery. Look at the very first item, protect and preserve the source of human health, nature. And you can go through and read the rest of it. I suggest you read it for yourselves. It's quite short. Notice the bottom one, incidentally, stop using taxpayers' money to fund pollution, by which they mean stop subsidizing the fossil fuel industry. They're very clear on that sixth point. So WHO is saying this. Health professionals around the world are saying it. I was one of the 4,500 individual health professionals, perhaps some of you were too, who signed this letter to the G20 leaders, 350 organizations representing millions of health professionals, and calling for a healthy recovery and calling for investments in key sectors like healthcare and transport and energy and so on. And we must have a prescription for a healthy recovery. So it's being said to the G20 leaders. And then here in Canada, the Canadian Association put forward a healthy recovery plan, which was endorsed, among others, I would point out, by you, that put forward the same sorts of ideas in a Canadian context. Again, the pandemic has exposed and exacerbated pre-existing challenges. In particular, I'd say the challenges of inequality. And so this is a critical moment to invest in the health of all and build a just, green and just future. And there's all sorts of health benefits from doing this. So some of the things we know, if we eliminate fossil fuels, you not only reduce, obviously, greenhouse gas emissions, but we'll get cleaner air as a consequence. If we have active transportation and public transit instead of a car-dependent society, we'll get more activity, reduced obesity, fewer motor vehicle crashes, and of course, reduced greenhouse gases and improved air quality. And then a low-meat diet, we know not only is it good for the planet, but it's good for us. It reduces disease and early death, especially cardiovascular disease and cancer. And on the right, you'll see the Chief Public Health Officer's report from 2017 on designing healthy living, which really that's a picture of a kind of a green community in many ways. And below that is the new Canada Food Guide, which is a low meat diet food guide. So we've got a number of things that are converging that we in particular need to be talking about the health co-benefits of shifting to become a one planet Canada. But they raise this fundamental question of what business are we actually in? Are we in the business of growing the economy, or should we really be, the way I put it, growing people? That is to say, maximizing sustainable human and social development. And I think, and there's no question, that we get a very different set of policies and economic approaches if we put well-being at the center instead of economic growth. This is the Canadian Index of Well-being, and quite clearly in Canada, while GDP has gone up 38% since 1994, the index of well-being has gone up only 10%. So we're growing the economy, but we're really not growing people. We're not improving human well-being as a result of growing the economy. So there's something going wrong here, something disconnected that we need to fix. And again, as health professionals, we're in a particularly powerful place to talk about this. So we need to, the way that I and others have put it, is to bounce forward to the new economy. The reference to not roaring back is specifically to a comment Trudeau made several months ago now, where he talked about the Canadian economy was going to come roaring back after COVID. And I was going, no, don't roar back to where we were. That's the last thing we should do. We need to bounce forward. That's another notion of resilience, is not bouncing back to where you were, but bouncing forward to something better. One way to think about this that I find very helpful comes from the Worldwide Fund for Nature in their Living Planet report a few years ago. Ecosystems sustain societies that create economies. It does not work the other way around. We tend to think of the economy as being the biggest thing. Who's the most important minister after the Prime Minister? The Minister of Finance. Well, sorry, that's wrong. It should be the Minister of Human Development or something like that, or Human and Social Development. That's where our focus should be, or it should be the Minister of Planetary Wellbeing for that matter. So we need to invert the pyramid, if you like. We need to move to this sort of notion that we create the economy and we can change it any way we like. We created it. It's ours. It didn't descend from heaven. It's something we created and we can change. I love this quote. Anyone who believes exponential growth can go on forever in a finite world is either a madman or an economist. Now, this was Kenneth Boulding, and this was almost 50 years ago, and he was a former president of the American Economic Association. So here's someone who knows about economics, and yet we have got a world of madmen where they think, and we think as a society, we can just keep on growing. Well, that's crazy. Instead, and this is Herman Daly, who's one of the great champions of steady state economics and ecological economics, enough should be the central concept in economics, where enough means sufficient for a good life. That's very much a one planet society, because what has to be sufficient also has to fit within the one planet. So we can think about things, and I'm going to flip through this quite quickly now, such as a steady state economy. The key point here, and this is from Dietz and O'Neill's book, Enough is Enough, and Dan O'Neill, incidentally, is a Canadian economist, ecological economist. An economy where the goal is better lives, not more stuff. That's where we need to be headed. And many of you may be familiar by now with Kate Raworth's notion of what she calls donut economics, where we need to create an economy that's big enough to ensure the social foundation at the center so everyone has water and food and health and education and all the other things in the center. That's the social foundation. And if the economy isn't big enough, or if it's not properly distributed, then you're going to have shortfalls. But it mustn't be so big that it exceeds the ecological ceiling and starts to damage those same 9, you will notice pretty much the same 9 sets of planetary boundaries. So within the social foundation as a foundation and the ecological ceiling, we need to find an economy that fits there. and that provides a safe and just space for humanity. And that's the notion of donut economics, which has gained quite a lot of popularity. For those who want to explore ecological economics more, the National Collaborating Center for Healthy Public Policy just published this report, which I wrote. It's called an interview, but it's not really an interview. It's a report I wrote, which they framed as an interview, that introduces ecological economics ideas to public health. Might be worth a quick look. And it's actually happening. This is New Zealand, where incidentally, of course, they just re-elected Prime Minister Ardern for another term. In fact, did so with a majority in a proportional representation system, which is very unusual, is really a landslide. This is what they're doing there. We want a well-being budget, they said, a well-being focus to drive the decisions we make, looking beyond traditional measures such as GDP. So this is what New Zealand's doing. We need to learn from them. This is their living standards framework. You might notice at the center, there's 4 forms of capital talked about here: natural and social and human and financial and physical. We've tended to focus only on financial and physical capital. We need to focus on natural capital and social capital and human capital as well. And we need to do so across a range of domains of well-being. And this is their domains of well-being. I'm not going to go into it. You can take a look for yourselves, but very similar to the domains of well-being that are in the Canadian Index of Well-being. So we've got the Canadian Index, we've got the model of New Zealand. We need to be doing this here in our provinces, and we need to be doing it nationally. If you look at the 5 priorities for their New Zealand budget that come out of a well-being approach, the word at the top there you may not be familiar with, iwi. Iwi is essentially tribe. So it's a Maori term that refers to the tribe. So this is creating opportunities for productive businesses, regions, iwi and others to transition to a sustainable and low emissions economy. Lifting Maori and Pacific income, skills and opportunities, reducing child poverty, supporting mental well-being. Those aren't the kind of economic priorities you see coming out of our governments very much. This is where we should be headed. So let me then conclude by talking about the notion of healthy cities and what I call Healthy Cities 2.0, which brings together both the idea of healthy cities and the idea of sustainable cities and integrates them in the notion of what I call healthy one planet communities. So in our region where I live in Victoria, our ecological footprint is a little bit less than the Canadian. It's about 3.5 to 4 planets. But again, we only have one. So we have to reduce our footprint by around 60 or 70%. We talk about the one planet community, and this is our definition. So Fiona mentioned I've set up a new NGO here in our region, and it's called Conversations for a One Planet Region. And it is exactly about what it says. We need to be talking about these ideas at a regional level. We're talking about climate change. We're not talking about all the rest of it, all the other factors that make up the Anthropocene. So we need to create a one planet community, which means achieving social and ecological sustainability. So the notion of social sustainability, not just ecological sustainability, and a high quality of life and a long life in good health for all, while reducing our footprint. That's what we mean, that's our vision. And I've already mentioned a number of the health co-benefits of a one planet community, but this is a framework that is being used actually in one of our municipalities, Saanich, which I happen to live in. A municipality of 100,000 people, the largest municipality in the capital region here on the southern end of Vancouver Island. And this is an international project organization called Bioregional, which is based in the UK and has been pushing the one planet living idea for almost 20 years now. And what I really want you to notice here is these top 3 elements of their principles, because this is not simply about sustainability. This is about health, happiness. How often do you see the word happiness in government documents, in government policies? But that's what we need: health and happiness, equity and local economy, culture and community. Those are the first three things, and then you get into the more conventional sustainable development areas. So this is an integration of these ideas. I'm not going to go through this other than to say that for each of the other 9 principles here, you can find quite easily health co-benefits of going that way. And that's what I did in these 2 tables. You'll have the PowerPoint afterwards. You can take a look at this yourselves. And again, I've covered this in terms of the health co-benefits of clean energy systems. So you can talk about this locally. Clean energy systems, a low meat diet, smaller portions. We have huge amounts of food waste. It's estimated that in Canada, up to 60% of food between the farm and our waste bins goes to waste. 60%. That's an obscene level of waste. If we all purchased less, we might all eat less, and that would be good for our obesity, and so on. So there's lots of ways to talk about this. I'm going to skip over this, except I love this. Michael Pollan, I think this should be our national food policy. In fact, in the new Canada Food Guide, it almost is. Eat food, not too much, mostly plants. Now, am I there yet? No, I'm not. Am I trying to? Yes, I am. This is another Lancet Commission, this one on sustainable diets. And this is the new Canada Food Guide that I mentioned earlier. Notice there's very little meat in there. There's a bit of egg, a little bit of fish, but a lot of nuts and beans and soy. So I want to come in closing to this, which is what's our role in all of this? And I've touched on this in several places. So what's our role as public health professionals? Sorry, that should say health professionals. Put my public health hat on for a moment, but it's actually health professionals within the healthcare system and as citizens. So as health professionals, first of all, we need to learn about and teach our colleagues about the relationships between human and ecosystem health. We need to examine the health costs of our present way of life and the health co-benefits of becoming a one planet community, wherever you are. We need to educate our peers, we need to educate the public about this, and we need to work with local community organizations, with local municipalities, with local businesses that are trying to do this at a local level. And I'm encouraging you to do a lot of local level thinking and action in all of this. And I know many of you do. And I can see Helen there on the screen, and I know she does that a lot. But then we are also health professionals within the healthcare system. So obviously we need to educate other health professionals, but does your health authority have an environmental or sustainability committee, or whatever your equivalent to a health authority is? And are nurses part of it? And I assume that they should be, but are they? Does your health authority know its environmental impact? Has it documented it? Has it done its ecological footprint? Almost certainly not. It's almost never been done. But there are projects, and Cape BC is developing a project to do ecological footprints of hospitals, for example. Does your health authority have a climate action plan? Maybe. Does it have a one planet action plan? Definitely not, I would say. So we need to take people the next step. We want to say, yes, that's wonderful. We're so glad you've got a climate action plan. Or, oh, we're so sorry you don't have a climate action plan. Can we help you to create one? Because it's really important. And by the way, you need to go more than a climate action plan. We need to go to a one planet action plan. Is your health authority a member of the Canadian Coalition for Green Healthcare? If it isn't, and many of them are, I must say, but if it isn't, it should be. And I'm sure you all know about the Canadian Coalition for Green Healthcare, so I'm not going to dwell on this. I helped set it up, so I have a certain interest in this. I just want to flag that this isn't, again, simply about energy conservation and climate. It's about all these other things. And so it includes sustainable food and safer chemicals and waste management and water conservation. This forms the basis, or would do, of a One Planet Action Plan. So sign up for that. Do the Green Hospital Scorecard, which will benchmark you against energy and waste and water use and all the rest of it. And it's going to be, I'm not sure they may have done this since I last looked last year, but they were going to have new sections on transportation and food and climate change. So get your hospital or your health authority to do the Green Hospital Scorecard and see where you're at, and then you can start to see how you can compare with others. But then also as citizens, are you a member of your local community association? Join relevant provincial or national NGOs such as CANE. Speak to your local councillor, to your MLA or MP. Write letters to or articles for your local or for the national papers, but do some local writing. They're usually looking for material. I write a regular weekly column for the Times Colonist. I've done so for 5 years. They don't pay me, but I retain copyright, and I get my word out there once a week to at least hundreds, if not thousands of people. Even consider running for election, especially locally. Run for local council, as some have. And remember this, you didn't give up citizenship when you became a health professional. So don't let people say, oh, well, you know, you're a health professional, you shouldn't be doing this. It's bias, it's active engagement in politics, blah, blah. You're a citizen. You're totally entitled. I ran as a federal candidate for the Green Party of Canada in 1984 while I was an associate medical officer of health in the city of Toronto. And I took the position which the city agreed to, that running for federal office was not a conflict of interest with my work as a civic servant for the municipality of the city of Toronto. They were two different jurisdictions, and evenings and weekends, I ran for the party. So you didn't give up citizenship when you became a health professional. And so this is what we're doing here in Greater Victoria. This is our website. We hold monthly conversations. We're looking at going in new directions with new ways to do this. So we're looking at kitchen table conversations, study circles, neighborhood workshops to design a one planet neighborhood, all different ways in which we can just get people to talk about this. And we have a motto that says, learn, discuss, understand, imagine, design, create. If we don't learn about and understand this, and if we don't discuss it, we're never going to imagine either what could happen if we do nothing or what could happen if we did something. And if we can't imagine it, we can't design it, we can't create it. So this is what's happening in Saanich. This is One Planet Saanich, which is a group that includes the mayor and others. And the mayor, incidentally, right in the center there, you've got the mayor of Saanich and Colin Plant in the yellowish shirt, who is the chair of the Capital Regional District and a Saanich councillor too. So there's good things happening at the local level. How do we create a One Planet Saanich? That's what this is all about, with lots of supporters and stakeholders in there. I'm just going to give you a sense of this is very widespread. So we need to think about, and I'll close with this, what can you do as professionals, as part of health organizations, as citizens? Think about who your key partners are, not just the usual suspects. Who are the unusual suspects? We're trying to work with faith communities. We think faith communities have a lot to say about this. And then what are the new opportunities? What are the new ideas that you can bring to your local? And often what you want to do locally, someone else has already done it. So you can bring that idea in and say, look, they already did it over there. No reason why we can't do it here. And with that, I will hand back the screen, and we've got time for some questions.
Hi everybody. Thank you so much, Trevor, for that really inspiring talk, and for all their wonderful ideas. My pencil's been busy taking some notes as well here. So
you do have the PowerPoint, and you can distribute it, so that will save a lot of note taking.
Thank you. That's great to know as well too. So I don't know if some people have some questions that they would like to, or some comments that they would like to ask Trevor.
Sure, I'll ask a question. We're going through some campaigns right now, trying to change government in Saskatchewan and so on. The well-being the well-being budget is, sort of essential to making all these changes. How do we actually get someone like Scott Moe to pay attention to a well-being budget?
Gosh, there's a challenge. I think that first off, you just have to start talking about it, so writing letters to your local paper, to the Saskatchewan papers, putting it, if it needs to be on the public agenda. At this point, it's not on the public agenda. And so why would he pay any attention? Because hardly anybody's talking about it. It's not an issue. So we have to make it an issue. I think there's a real opportunity to do so based out of being a health professional and based out of the COVID experience, and to say, look, this is what we can learn from COVID. This is and bring in ideas such as the Canadian Index of Wellbeing, and bring in ideas such as the Wellbeing Budget from New Zealand. But we have to put it on the agenda. So writing letters, speaking out at public forums, and I don't know how much more time you have left, and we don't really have public forums right now in the same way, is a problem. Once the election is over, and I don't know which way it'll go there, but I'm guessing it'll be Scott Moe re-elected, I think you need to find a way, probably with allies. I also think you don't want to just try and shoulder this burden as the small chapter of CANE in Saskatchewan, but who do you partner with to put this forward and be part of a coalition around a well-being budget or a green recovery or any of those? Tying it into the notion of a green recovery is really helpful. I think attacking some specific points where I suspect the government of Saskatchewan are bad players, such as fossil fuel subsidies, is really useful and worthwhile. And again, you can bring in the World Health Organization, which says very bluntly, you have to stop paying for pollution. And that's a good way to put it. Why is the government paying for pollution by subsidizing fossil fuels? So those are some ways to do it, but I think it has to be on the social and political agenda. And if it's not, then he's not going to pay any attention.
All right, thanks.
Hi there, Trevor. Oh, we got you. Go ahead, Hilda. I'll follow.
Trevor, there are a lot of faith groups working. There's Faith in the Common Good, and there is more planetary faith groups coordinating. And as a matter of fact, I've gotten my faith group involved with the Waste Reduction Week in Canada, and having one of their plastic pollution that we are co-hosting with them.
That's excellent. I think faith communities are a much underestimated resource, if you like. I'm not sure I should call them a resource, but partners, allies. And again, if you engage with faith communities around the idea of a well-being budget or a planetary well-being budget or something like that, I think there are, and try and make it incidentally multi-faith, because in any faith you care to look at, you're going to find something in there about safeguarding the planet or respecting the creator's creation or whatever it may be, however it's framed, it's there. And so you can build on that. And there's quite a lot of interfaith work going on too, which I think is really important. But bring them in, make them allies. The way that some of our local faith communities, local churches have approached it is they were already doing a lot of work on social justice. They're now doing work on eco-justice, because the other thing is there's a big social justice dimension to all of this. So we talk about not just a healthy recovery, but a healthy and just recovery. We talk about a just transition. And faith communities tend to be often quite concerned about social justice issues. So link that up to ecological issues and talk about eco-justice, which can be local, as in who's underpaid and underappreciated, or it can be global, as in who are we pushing into poverty in order to meet our own material needs back here at 5 planets worth of consumption. So I think they get all that, and they're great potential partners. Thank you for that.
Jessica, you have your hand up. You have a question.
Yes, thank you so much, Fiona. Trevor, there are so many questions that I wanted to ask you, and I was trying to see which question rose to the top. And I suppose just given that this is Kane's AGM today, my burning question for you has to do with the fact that I was, of course, reminded that you were the reason that CAPE exists, or certainly very instrumental in that many years ago. And Kane has really, in the last year, been reaching out to CAPE. I think it's actually been going both ways, and it's been really wonderful to finally be linking more strongly with that group. And so, again, just being really cognizant of how amazing that organization is and how far they've come. I'm wondering if you have any reflections on CAPE's journey from the very beginning, lessons for us, as you know, although Kane's been around for now a decade, we still, I think, feel very much like a new organization. So any thoughts on how to grow our organization, how to get closer to where CAPE is at, because you do such good work?
Well, I mean, we started, really, there were three of us. It was Warren Bell and myself and a guy called T. Guidotti, who is now down in the US. And we found each other and started to put it together. And for a while, it was not very much. I think that what made it in part was we, from the early days, took a strong advocacy position. We were outspoken. We worked as citizens, and we sought partners. So, you know, the Canadian Coalition for Green Healthcare really emerged as a partner between CAPE and Pollution Probe and some other key organizations initially in Ontario. And then we managed to bring in and the Ontario Hospital Association. So it's about building those partnerships, partly with the usual suspects, but also with the unusual suspects. And then I certainly think it's recruiting. So how do you make this relevant to nurses, not just in hospitals, but across the spectrum? Public health nurses, for example, because they're out in community, should have an appreciation of some of the health co-benefits of being a one planet region or community. I mean, all of us do, but they're particularly, that's their job in a sense, is to be there. So I think you have to both recruit people, and you have to be seen to be active, you have to be visible, you have to be in the public eye and also in the profession's eye. So we worked with and I'm sure you do, we worked with particularly the College of Family Physicians, actually, who are much more grounded than specialists. Specialists are, you know, if you're a cardiac surgeon, well, even, you know, it may be more remote for you. The other big place where you can do it is nurses tying it into their work experience, their job. So, you know, if you look at what makes a hospital green, it's usually what makes it healthy. So having lots of pollutants in the workplace is unhealthy for the environment, but it's also, of course, unhealthy for the people who work there. And it's not just nurses, of course, it's all hospital staff who are working in these environments. So again, I think take the hospital scorecard and champion it. That would be one way to do it, because you're all, or many of you are either within hospitals or within health authorities for sure, and get your nurses unions involved, you know, and make it part of working conditions agreements and things like that. So be fairly hard-assed about it.
I think that's great advice. It's something that maybe nurses have a bit of a struggle with as well too, somehow, I think, as well.
I think you have to exercise tough love.
Yeah. I just have a question, maybe myself, and I can pose, because I'm just thinking of all the things that you have done, and that, you know, being in quotations retired now, and having founded this this new NGO organization as well too. So I guess it's, you know, thinking about the strength or the reserve that you have in yourself, you know, that because I think that we also see a tendency for people to turn away from the very disheartening news about planetary health, the state of the world, and sometimes the reaction is for people to feel that it's beyond their capacity, you know, and that it's better just to kind of deny it in a way. And so, what is it that in yourself that has enabled you, do you think, to be able to still to do all this and still continue now, you know, in the face of a lot of bad news?
Well, I guess first off, I'm generally of a sunny disposition. I'm sort of the little Energizer Bunny eternal optimist. That's just who I am. That helps, of course. I think a really important thing, and I tell this to my students, is it's really not my job to save the world. I can only do what I can do, which may be very small or it may be very big, but I can only do what I can do. It's not my job and it's not my responsibility to save the world. And if you put the weight of saving the world on your shoulders, you're going to burn out and you're going to have a miserable time. And I think another piece of it is have fun. So, and Wanda can testify to this, but I go dancing once a week, twice a week. One of our sides has kind of run into COVID problems and stopped. But anyway, I go dancing. I go out and hike in nature. We walk the dog. There's stuff you have to do that is just fun, that isn't to do with the work, that is outside of the work in a sense. And dancing, singing, and drinking, which is what we do when we get together, is a very good way to forget the weight of the world. Thirdly, I think that if you only see it as we're doomed, then you're going to withdraw. You have to see it as a challenge. And particularly when I talk with young people, I talk in terms of hope and opportunity. So you have to have hope. And my friend Thomas Homer Dixon just wrote a wonderful book called Commanding Hope that just came out last month about hope and what hope is. And he avoids sort of naive and useless hope, the sort of Pollyanna hope of, I hope the world will be a better place. That's not really hope, that's wishful thinking. But to see that there actually is hope the health co-benefits, for example, is a great way to frame it. Here's all so yes, there's these challenges, but if we go this way instead of that way, here's all the good health things that will happen. That's hopeful. And there's all sorts of opportunities, because we're going to have to reinvent everything almost as a society to go in this different direction. And when you're reinventing everything, there's all sorts of opportunity, and young people totally get that. They get all excited when you talk about hope and opportunity. So yes, there are real challenges. You can't just ignore them, pretend they don't exist. But then you have to go beyond that and say, but look, if we did this, and it really helps if you can say, they're already doing it. Like the well-being budget, they're doing it in New Zealand. We could do that here. BC is about the same size as New Zealand. Politically, not that different. Constitutionally, not that different. We're both ex-British colonies. So, that's a useful model that fits here that we could use. Those are some of the ways, but especially dancing, singing, and drinking.
I think you got a few claps for that too. A lot of people can relate to that, I think, for sure. So, well, I'd just like to, I guess, thank you so much, Trevor, for this really wonderful and very inspiring talk. And I know some of our participants have said that, they're going to bring the suggestion of the Green Hospital scorecard forward and in their workplaces. And so, plus thinking about all of the other suggestions that you made as well too, in terms of personal life and political life, and as health professionals as well too. So I would really like to thank you very, very much for giving the time to all of us as well too with this excellent talk. And thank you so much.
Oh, it's been a pleasure, and thank you for the invitation. It's always, I've spent a lot of time, particularly in public health, working with nurses. Most of my good professional friends and colleagues are actually nurses, not physicians, and that's always been the case. So it's a pleasure to be here.
It's certainly been a pleasure for us. So thank you so much.
Okay, I will leave you to it.
Okay.
Bye-bye.
Okay, thank you so much. Bye-bye, Trevor.
You might want to stop recording, by the way.
Yes, I shall do that.